Today we will be talking about Alzheimer's disease in relation to Diana Fitzgerald, who is a 71-year-old female who has been diagnosed with Alzheimer's. She is a retired teacher who currently lives in a retirement village. She enjoys socializing with other residents and partaking in the centre craft lessons. She is slightly overweight but does undertake short walks 2 to 4 times a week, depending on how she is feeling. She has never been a smoker, but she used to drink wine almost every night until a couple of years ago when she changed her habit to only drinking occasionally. The hippocampus is known to be affected by Alzheimer's as it is part of the brain that forms and stores memories. Alzheimer's destroys neurons and connections to the brain that are involved with memory. Having a loss of neurons can cause many issues involved with the neurological functions. In the case of Alzheimer's and dementia, this is shown through the developing loss of memory as more and more neurons are destroyed. Another brain structure impacted by Alzheimer's is the frontal lobe. The frontal lobe is known to be where the encoding of memories takes place. If damaged, this can result in difficulty in retaining new information, understanding spoken words, identification of objects, and recognizing faces. When both of these areas of the brain are impacted, the development of Alzheimer's can become quite rapid with a steep decline of brain function. The most important signs and characteristics for dementia include difficulty with communication, problem solving, organizing, or more easily noticeable changes such as confusion and disorientation. All of these can be connected to both progressive and reversible dementia. If diagnosed and treated early, the consequences can be reduced by a significant result. As mentioned previously, Alzheimer's and dementia are normally caused by an impact to the functioning of the brain. However, in some cases, other conditions can cause deterioration in areas of the nervous system and can create an onset for dementia. This includes Huntington's disease, which is when nerve cells in your brain and spinal cord waste away, a traumatic brain injury, which is often due to repetitive head trauma, and Creutzfeldt-Jakob disease, which is often due to deceased brain and nervous tissue. As mentioned previously, Alzheimer's is often due to the deterioration in areas of the nervous system. In some instances, this can be caused by other events such as amyloid beta plaques. These are often formed due to the action of enzymes cutting through amyloid precursor protein, which are located on the surface of neurons. In doing so, they reveal another protein called beta amyloid. Depending on how healthy a brain is, these are normally broken down and eliminated by the brain. However, in the brain of those with Alzheimer's, they will clump together to form sticky, insoluble plaques. These clumps build up and are able to block cell communication at the synapses. Although it has not been proven to be a cause for Alzheimer's, it has been shown as a reason for decline in cognitive ability. Neurofibrillary tangles are very similar to amyloid beta plaques in that they are an accumulation of protein in the neurons. This protein is called tau, and for those with a healthy brain, would normally be bound to microtubules to assist with stabilization. However, for someone like Diana, Alzheimer's disease causes abnormal chemical changes. This can cause proteins like tau to detach from microtubules and clump together with other proteins, eventually forming tangles that block neuron transport system. This creates difficulty with communication between neurons and causes decline in cognitive ability among those diagnosed with Alzheimer's. Both amyloid beta plaques and neurofibrillary tangles show evidence as possible reasons as a decline for Diana. Not only has she been diagnosed with Alzheimer's, but she is also 71 years of age, which already plays a factor in this decline, regardless of her diagnosis. Morphological changes associated with Alzheimer's disease are normally connected to the normal aging process that takes part in the brain. However, a study published in 2001 identified a significant reduction of grey matter volume amongst those diagnosed with Alzheimer's. Grey matter is tissue that makes up the outermost layer of the brain. It gets its grey tone from the high concentration of neuronal cell bodies that are located there. This reduction was especially shown in the bilateral hippocampal formation. As mentioned earlier, the hippocampus is the section of the brain that forms and stores memories. If there is evidence to prove that there is deterioration in neurons in these areas, it makes sense that there would be a decline in memory, which is usually the earliest sign for Alzheimer's. The most common type of medication that would be administered, Diana, are cholinesterase inhibitors. These include donepezil, rivastigmine, and galantamine. The reason that these are often prescribed is that those diagnosed with Alzheimer's have low levels of acetylcholine. This is a chemical that assists in sending messages between nerve cells. These medications prevent an enzyme called acetylcholinesterase from breaking down acetylcholine. These create better communication between nerve cells, which as a result assist in delaying the developing severity of Alzheimer's for a patient. For Diana, something like donepezil would be beneficial long term. It has been found to have improvements on amyloid beta plaques, as the administration of donepezil over 6 months has been known to decrease the amyloid beta plaque disposition in the cortex and hippocampus. This can help delay the onset of Alzheimer's and allow someone like Diana to adjust to a diagnosis and not worry about it progressing at such a fast rate. Other ways that Alzheimer's can be delayed are things like diet and exercise. Maintaining a healthy lifestyle is one of the most simple ways that the development of Alzheimer's can be reduced. Although she is slightly overweight, Diana has reduced her alcohol intake significantly and also tries to walk up to 4 times a week, with this being dependent on how she is feeling. She has demonstrated that she has helped herself in this process with her lifestyle choices and has put herself in a slower developing demographic. Cognitive training is also believed to be a successful way to help counteract the deterioration of brain function. A study published in 2017 found that adults 70 years and older found that participating in games, crafts, computer use, and social activities was associated with a lower risk of mild cognitive impairment. As mentioned earlier, Diana takes part in the craft lessons available in her retirement village, which has proven through this study an area that can allow Diana to even further delay onset for Alzheimer's.